I'd like to call to order the August 14th, 2012 regular meeting of the Boulder Valley School District Board of Education. Sandy, will you call the roll?
Albright. Here. Belville. Here. Benford. Here. Fuqua.
Here.
Myers.
Here.
Reed.
Here.
Smith.
Please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to remind all who have gathered here tonight that the vision of the Boulder Valley School District is to graduate students in the new century who have the knowledge, skills, and personal characteristics that will make this world a safer, more thoughtful, and more inclusive place in which to live. Begin with our first agenda item, the superintendent's report. Dr. Messenger.
Good evening, everyone, and welcome. I have just a few items I would like to share with you, and then I'd be open to any questions that you might have. As you know, the staff are back, and we are preparing for the opening of school this week, and so we'll have students that arrive tomorrow and the remaining students on Thursday. So we're looking forward to that. We've been busy, we collective, lots of support staff and others preparing for the start of school. Logistics, we are thrilled that the intersection is now open so our buses can leave the bus terminal and pick up the children. There was a time last week we weren't sure that was all going to come together, but it appears that that's going to happen. So, so there are a number of things that always kind of come to a head at the end of the summer as we prepare for the opening. One of the things I'd mentioned, I visited with Assistant Superintendent Don Orr this morning, some of the heat mitigation efforts around recirculating of air and also making sure all systems that we do have are operating at their most efficient and effective manner, and we're confident that that's the case. Now, we acknowledge that nearly half of our classrooms aren't air conditioned, so there are limitations to what that can do, but one of the concerns that was expressed to us last year and we visited with the board about, and we'll give an additional update after the first couple of weeks of school, that some of the systems simply weren't operating in the way they were designed to. So if we can have these nice cool evenings continue, even when we have very warm days, that helps us with that refreshing of the buildings in the early morning hours. So that work, and then we are proceeding with placing the window tint on the 20 buildings that are not air conditioned or have some portions that aren't air conditioned, and that's in process and won't be completed by tomorrow, obviously, but will have some effect, we believe, as well going forward. Around enrollment, I would just say that we're obviously monitoring that very close as we do, and Glenn and Mike and our folks in enrollment and planning, we have certain dates by which we monitor that and try to see if we're where we anticipated we would be. And so overall, I would say yes, we might be off some with our projected kindergarten count, so we're watching that real closely, and mostly to make sure that we have the all the teachers in place and we're ready to receive children this week. So enrollment is an area that we'll continue to track, and we'll give an update on that. Obviously, the count date is in October, so that's an important date for us as well. Overall, with staffing, as you might recall in our budget planning process, we kind of emptied the reserves out of the assistant superintendent's budgets in order to have a staffing plan last spring, and so we've done that, and then you obligated funds out of what we've called contingency or one-time funds to be available to support in case we had some surprises. And so we have responded with some additional sections or support here and there, as we've seen normally what would have been done through the assistant superintendent's budget, but having that not available, we've responded out of this contingency fund. So we still have going into school tomorrow, we still have a strong balance there, but we'll continue to monitor. We may have some additional support that needs to be added in the next few weeks or even throughout the year. So we'll give a more formal update on that, but so far so good with being able to maintain the class sizes and the commitment that we had started our planning with. I would just give you an update because you might be reading some about it. The U.S. Department of Education has repackaged, I guess you would say, the Race to the Top applications. In the past, that has been state-level competition for those grants, and there is a new round of competition that's been released for districts to consider. So they come not from state applications, but from district applications. So just within the last few days, we've gotten, they took comment through the summer, and so now we have a more definite look at what that application could look like, and to determine whether we would qualify as a district to make application. We reached out to St. Vrain School District in early summer, and just as we were monitoring this to see if they might want to partner with us on that, there's some potential benefit from working together with another school district, and so we have, so we're exploring that, and we think there are some common areas of interest. So a final decision has not been made as whether we'll proceed with developing the application, and if we do it in partnership with the St. Vrain School District. That we're very much in that discussion right now. One, we want to make sure we're even eligible to compete, and also that the criteria for award would be consistent with where we see desired outcomes for the district, always so looking for that alignment. So we're still very much in the early stages of that, and I'll keep you informed if we choose to proceed. The application is due at the end of October, so what, a 2-month window, 2.5 months that we'd have. It's a pretty extensive application if we choose to pursue it. So we'll keep you informed with that, but that's a little bit of change in both who can compete for those grants and what the criteria are around it. So, Mr. President, members of the board, I think that completes my report. I'd be glad to answer questions about topics I didn't touch on or expand on any of those.
I just have a quick question. So is there a minimum, like, free and reduced lunch percentage for a district?
There is
that
a
one of them?
threshold, and so the way this appears to work is that we'd identify a set of schools. So it is the Title I schools, of course, and because they're the highest concentration of poverty, and then looking at a pathway through our system so that it would be K-12. It wouldn't be just those schools. Being a Title I school isn't a criteria, but the density of poverty in a pathway of schools allows us to, so we would make application around that set of schools, or in those thousands of students in that set of schools. The same would be true of St. Vrain. So then in combination it gives, so then there's thresholds for the amount of funding we could compete from, both on district size and also the number of students that would be eligible under those criteria. So yes, impact of poverty is one of the major criteria for making application.
Great, thank you.
All right, thank you, Dr. Messenger. Our next item on the agenda is public hearing and public participation. Sandy, I'll dispense with the reading of the script. So the next agenda item is board communication. Board members?
Okay, I have something.
Jenny.
I remember to turn on my microphone, although I don't think it matters. Okay, so I recently received a communication from one of the attorneys at CASB, staff attorneys at CASB, who is also a parent in our school district, and we're fortunate to have her. And one of the concerns, she raised a concern about school safety issues, and it's an issue she's working on at Lafayette, but CASB has not yet developed a policy on school safety, but they're working on it, and they have recommended policy language also for school boards, which reads something like, CASB recognizes the close correlation between student health and safety and achievement. CASB supports state and local alignment on issues related to student health and safety, and encourages local boards of education to develop and implement policies and programs designed to ensure that all students are healthy, safe, and supported. And she was hoping that our school board could bring itself to support that kind of a policy on CASB's part, and perhaps something locally as well. So anyway, and it sounded to me like something that sort of fits into our whole goal development topic and concerns, ongoing concerns, both of our board and community. So I bring this for our communication, our consideration, and perhaps we can develop something and work on it for an upcoming meeting sooner rather than later. And you were going to get some feedback from.
Sent that out to Cabinet and a few others that work in this area if they get any comment or suggestions they might have. So if I can see that.
Cool. And we do have a legislative resolutions committee meeting on Friday, so I will tell them that I've raised it, and I don't think I hear any significant objections.
Okay, Lori?
Well, and as it relates to CASB, I think it's not necessarily a legislative issue for them, but a policy issue.
Yeah, you're
It's for them as one of their tenets of what CASB believes. what they need, I think, is a school district to bring it forward. And so we could, I mean, I think it would be terrific if we would bring it forward at in the fall meetings as something that CASB supports. It's important for it to be, I think, a plank in their policies.
So you're one of our delegates, so if we get something in place before those school meetings happen,
Right, yeah,
so you
that'd be
have a
great.
timeline, you have a better timeline than.
Right, and there'll be a meeting in, I think it's in October, to talk about what the resolutions will be that are the guiding principles of CASB. I mean, I totally agree with the content of it. And I would love our feedback from our staff about any questions about the language. I think it'd be terrific. That'd be good. Can I keep talking? Sure. I'm glad to be back. It's nice to be here. The other thing I would just say about CASB is I'm on the board of directors of CASB, and we've had a couple meetings this summer to talk about school boards and relevancy of school boards, particularly as it relates to the fact that there are a lot of not parent necessarily, but organizations in the community that are interested in weighing in about school policies. And so I think it's something for us to think about as an elected board that represents our community, to be aware of what our roles are, what our responsibilities are, and just to be thinking about other organizations that also want to be involved in some of the decisions that we make. Now, clearly we've got a budget, clearly we've got legal obligations and permission to do many things in the Constitution, but I do think it's interesting to think about the roles of elected officials, particularly in light of just what goes on in our country about legislative issues and policy issues. So it's something I'm thinking about and will be continuing to think about through the fall and I think through this year. And it's just instructive to think about how important it is as our board to do really good work representing our community and making sure that we're following their values and representing, doing the best we can for our kids. So it's a kind of a wake-up call for me to listen that CASB's thinking about this. And I think other statewide organizations, the Teachers Association, Administrators Association, are also looking at the similar kinds of questions. So it's just kind of the new political reality, I think, that we might be facing. So something to be aware of. So. And that's it. I guess we're started, right? We're at the top of the roller coaster or something, as the kids say.
Yeah. All right. Leslie? Thanks.
Well, I just wanted to welcome everyone back and wish all the students a good start to the school year. I know a lot of them are starting tomorrow, but on Thursday it's only supposed to be in the 70s. I was pretty excited to see that from Germany last week even. And, you know, this year we've got some big things that we're going to be tackling, the goals for the district, community engagements, possibly some new ideas about community engagement, the calendar. And I know we've been getting emails, and I've actually been getting emails or inquiries from friends about the calendar. And the committee meets every 2 years, and they'll be getting together and making recommendations to us. So that will be on our agenda also, and that always brings a lot of interest. So, yeah, I'm ready for school to start, and I'm ready for my kids to start school.
Thanks, Leslie. Tom?
Well, it's great to be back. It was good to have a little time off. And, you know, when you have a little time off, you can reflect a little bit better and think a little bit more proactively rather than reactively, is oftentimes that we do in dealing with the problems and the issues and the challenges that we have. And just having that recharge is great. And I thought back to the school year, and you know, we have a number of successes. And I won't try to mention them because I'd obviously leave out some that shouldn't be left out. And we should, you know, celebrate those, obviously. Those are great things that we did. I'm enthusiastic about the coming years. I think we've laid some good groundwork to move forward and change significantly the way that things have been done in this district, associated with how we tie in our goals to a strategic plan, how we implement that plan, how we monitor that plan, and where we can start looking at focusing on the things that are working And, that's some of the challenges that we face is how do we monitor things and how are they working? Sometimes they're very difficult to understand and take a long time to monitor. But I am enthusiastic, and we've got our work cut out for us. We need to get our goals clearly thought out, our strategic objectives clearly thought out. We've got some good possibilities of some people to help us with that. I also was thinking about how we do things more efficiently. And Bruce, I sent you an email today, some things that have happened in Thompson District where they've actually utilized some people at Ball that do manufacturing, lean manufacturing, it's called efficient manufacturing. And they've worked in that district, and actually this individual has developed an application of how to take that into a school district. So we might want to consider if that's worth having and see if he'll do it. Maybe I can twist his arm into doing it if we are interested. So those are some of the things I think that we lay out for ourselves here in the future, because I think we're going to have continued budget pressures, as we go through. Certainly into next year, we'll have, next year's budget will have more expenses, and a jump in expenses, particularly with the with the new salary schedule coming in. That's going to hit us full bore next year. So those are some of the things that we have to plan for, and I'm optimistic. I believe that we can, and so let's get started.
Board member said it well. I just say welcome everyone back for another great school year. So I'm sure the staff was busy all summer, and I know the administrators for buildings got back a few weeks ago and have been working. They probably didn't get much of a summer, but I hope everyone did get a chance to recharge a little bit, board members included. So with that, I think our next order of business is an information item, the Youth Risk Behavior Survey. Dr. Messenger, I'm not sure who's going to introduce this.
So this conducted, and which will be explained to you every 2 years, and so we've advanced some of the information to you, so you had a chance to do kind of a sneak peek of what's going to be presented tonight, and then I know that after the presentation there'll be an opportunity for questions and answers, so I'll turn it over.
Everybody. I'm Navina from Public Health. A number of colleagues here, Lucy Alderton, Heath Harmon, Andrea Poniers, and Leisha Connors-Bauer, as well as other teammates who are not here tonight, but without whom this would never be possible. We are really excited to be able to come tonight and share data, information that is already contributing to your strategic planning process. And we're really appreciate you inviting us in and listening and acting on the data. And in terms of celebrating successes, well, last fall, less than a year ago, 2,873 Boulder County middle and high school students in 143 classrooms in 32 schools in 2 school districts took the YRBS and gave us their heartfelt responses to very sensitive questions on harassment and drugs and sex and depression. How could anybody pull this off? Well, how? Because we have the support of the school board in both districts, as well as parents, teachers, and others. The YRBS collaboration marks its 10th anniversary this year. It's been a really exemplary partnership in identifying youth risk and preventive behaviors and then acting on that. I'm going to whiz through an abbreviated version of the PowerPoint that you received by email yesterday. If you want more information, you can go back to that either through your email or it will be posted online tomorrow, as well as all of the data tables that you received. All the data's out there for mining. So here we go. As I said, it was a very successful year, as have the years 2001, 2003, 2005, 2007, 2009. I want to remind everybody that in each school, just about a quarter of the classrooms in just one class period on just one school day are surveyed. But because of the scientific sampling method, and the high response rates we get with Boulder Valley School District, the results are generalizable to all the students in the participating schools, not just those students who took the survey. And this makes the YRBS a very strong source of data for your evidence-based programming. Just to remind folks, the YRBS measures these 6 sort of categories of risk and preventive behaviors. Plus, we've got a few of other questions outside these areas. We're looking at things like perceptions of risk, peer activity, preventive health behaviors. So today we're going to look at the 2011 data, and we'll start with the high school data, looking at some areas of success and some challenges, where we want to improve, what areas, in which kids, and when. So one way that we can see how BVSD students are doing is to compare them to students nationwide. So of the behaviors that we measure here locally and that are measured at the national level, there are a couple of areas in which, actually more than a couple, a lot of areas in which BVSD is doing a lot better than nationally. So these are statistically significant differences. So this whole list, which I'm not going to read and you have access to, are all the places that are measured where BVSD is doing better than nationally. I'm not going to go over it. There are also a lot of areas in which BVSD is doing better than our state students. So there are some areas, unfortunately, in which BVSD behavior is not as good as around the nation. Luckily, it's a shorter list, and that's this list here. Again, this is in the PowerPoint that you received, and it's behavior sort of all over the place. There are some behaviors related to drinking and smoking, some related to weight control, mental health, etc. So let's take a look at some actual prevalence rates, starting with what's new in the 2011 survey. In response to suggestions from district staff and teachers and partners, community partners, we asked a couple of new questions in 2011. We found out that over 4 of 10 students reported that they had eaten breakfast on all 7 days before the survey. 1 out of 10, however, reported that they had gone hungry because of lack of food in the house. Nearly 3 out of 4 that reported that they had had a checkup with a doctor when they weren't sick or injured in the previous year. And 3 out of 4 reported that they had seen a dentist for dental work or a dental exam. So likewise, we've got some new questions or differently analyzed questions in 2011 that show us sort of some baseline measures for risk behaviors. One of the suggested questions that came straight from BVSD was texting while driving. So among those students who did drive in the 30 days prior to the survey, that's about 63% of your students had driven. Nearly half of them, that's 46%, and 60% of seniors reported that they had texted or emailed while driving in the 30 days prior to the survey. That's something to think about. We've got nearly 1 out of 4 students who reported that they had been harassed on school property in the 12 months prior to the survey, and about 1 out of 10 who reported that they had been harassed on the way to or from school. We've got 1 out of 20 or so students reporting that they had been threatened or injured as a result of gang activity. That's another question that was directly requested by Boulder Valley School District. And about 1 out of 20 students reported current, frequent, or heavy cigarette use. So those are some of the new questions. There are other behaviors that we've been tracking since 2001, or sometimes a little bit more recently. And before I go into those, I want to remind everybody that a change in even a few percentage points can impact youth health. That when I say the word significant, I'm talking about statistical significance. That's non-overlapping confidence intervals for the data geeks out there. And when I say the word trend, what we're looking at is a significant change over the last 3 survey administrations. So that means that something has gotten better, or worse, better from 2007 to 2009 and 2009 to 2011, or worse, 2007 to 2009 to 2011. So keep that in mind as we take a look at these. So First, let's look at issues that we first measured in 2009. That was sort of our baseline, and now we've got them again in 2011. Some of those questions, they're not all listed here, are whether students had been electronically bullied, they had used a prescription drug without a prescription, had they been able to buy cigarettes in a store, etc. There are 3 on here with arrows, and those 3 are worse in 2011 than they were in 2009. That's kids who had been electronically bullied, kids who are obese, and kids who watch 3 or more hours of computer or video games on an average school day. So some things doing all right, some things doing a little worse. So there's other behaviors that we have been monitoring for quite a while, and you all want to know what's going on with those. What are the favorable and unfavorable trends? So let's take a look at that. There's actually only 2 trends that go all the way through 2011. There's one good and one bad. The good one is that drinking alcohol before age 13 has decreased from 2007 to 2009 to 2011 significantly. The bad one is that the perception of smoking marijuana as being a risky behavior has also decreased. So kids don't see marijuana as so risky. So those are the 2 official trends by our definition. Let's look at those a little bit more carefully. In terms of early initiation, smoking, drinking, doing things like that before age 13, here we see alcohol, cigarettes, and marijuana. The trend that I mentioned is the one in drinking before age 13, and that is a trend. It's going down. The other 2 have remained steady. This slide has a lot of information on it, and I'm just going to hit some high points. What we asked the students, we asked 3 different things. How wrong do your parents or guardians feel that it would be for you to smoke or drink? How much do you think people risk harming themselves physically or otherwise by smoking, drinking, etc.? And how wrong do you think it is for someone your age to smoke or drink? What we see here are a couple of things. We see that students' perceptions of parental disapproval is way up here, and their perceptions of risk and whether it's bad is way down here. So we'd like to bring those up. We also see that of the 3 substances, cigarettes, marijuana, and alcohol, all 3 scales, student perception of parental disapproval, student perception of risk, and student disapproval are the lowest for marijuana. And again, we see that trend that for the perception of risk of marijuana that is getting, there are fewer kids sensing that it's risky. All the way we first started measuring in 2005, and the trend continues into 2011. And one more thing is to note how much the student perception of the risk of cigarettes is so much higher than marijuana and alcohol. So we have been able to make some progress there. So those are the 2 areas of actual trends that we're seeing. We continue to track other behaviors, and I'm just going to flash through these slides. We continue to track harassment. There aren't any trends continuing into 2011. We continue to see harassment because of a number of causes, especially weight, size, and physical appearance. And when you see these graphs, you see these lines that are way down towards the bottom, you think, well, 5%, that's pretty low. Maybe we're doing all right. But that percentage represents a lot of kids. So, for example, the student population in the high schools, the high schools that were surveyed in 2011 was 8,167. So 5% is 408 kids. If you think about that as sort of perhaps 15 classrooms full of kids who have been harassed on the basis of their religion in the past year, that's a lot of kids, and we need to pay attention to that. Violence, we continue to see these types of violent behaviors, being in a physical fight, unwanted sexual contact, carrying a weapon, being forced to have sex. Again, no trends into 2011. Mental health concerns like feeling sad or hopeless, considering suicide, attempting suicide, also holding steady. And sexual activity, using a condom, ever having sex, being currently sexually active, and having had sex before age 13. is pretty steady, and smoking and drinking as well. All the data on this will be available online if you want more information on those. So that's really the what. Those are the kinds of things that we're tracking and some of the major trends. The next question is who. Where do we want to focus our efforts? So in which groups are we seeing more risk behavior and less preventive behavior? There's disparities all over the place. In general, the prevalence, there's a generalization. The prevalence of risk behavior is higher in Hispanics and non-white, non-Hispanic others than it is in white non-Hispanics. It's higher in males in some areas, such as violence and marijuana and drug use. It's higher in females in other areas, so depression, suicide, alcohol use, electronic bullying, things like that. And pretty much across the board, it's higher in lesbian, gay, bisexual, and questioning students than it is in heterosexual students. And likewise, the prevalence of preventive behavior is lower in these groups. So kind of a double whammy there. Very quickly, these are just showing differences between different groups by race and ethnicity, gender, sexual orientation. So that's the who. When does behavior seem to get worse? So we looked at 9th grade compared to 10th grade, 10th compared to 11th, and 11th compared to 12th. And we found that the big difference is between 9th or the biggest difference, or the most differences, is between 9th and 10th grade. So perhaps where's the most bang for your buck? Earlier on in those high school years. Speaking of earlier on, in 2009, we started administering the middle school YRBS, so we now have 2 survey years to look at in terms of middle school data. Remember that the high school data is not comparable to the middle school data because the wording on the questions is different, right? Doesn't mean it's not valuable, not comparable. There are a lot of areas to celebrate, long list of the areas to celebrate in which we're doing better in 2011 than we were in 2009. There are some areas of concern. Those are students who never or rarely wore a bike helmet, students who carried a weapon, students who exercised for weight, fasted for weight, had 1 or more PE class per week. Obviously, some of those it's better to have higher rates. Others it's better to have lower rates, but those would be areas to focus on. Again, among the middle school students, you see a lot of the same disparities. Here's just one example. We see grade here, and there's statistically significant differences between 7th and 8th grade. So again, these behaviors are visibly incremental. So how does the YRBS support efforts to help Boulder Valley School District youth? Well, as I've said, the YRBS shows what behaviors to impact in whom and when. Really helps to focus resources. So we measure the prevalence of these risk and preventive behaviors. We monitor those behaviors over time and inform and educate and empower the community. We then develop health and education programs and policies and laws and evaluate those efforts afterwards. It has helped us to justify funding and resource needs and to prioritize what we're doing. My colleague, Leisha Connors-Bauer, is going to talk in a little bit more about these slides, but just to, I'm going to finish talking and let her talk. The Healthy Youth Alliance did a survey after the release of the 2009 data among over 60 Boulder County youth serving organizations, and they asked about how the YRBS data was being used. And what they found is that these local initiatives are using it for strategic planning, they're using it for building capacity, program planning and evaluation, et cetera. And they also looked at the areas that their programs impact. So sort of looking at the distribution across those different YRBS areas. The longest bar here is in mental health, but followed closely behind by substance use and the other areas. So for me to wrap up, there are a lot of areas of overlapping concern and action. As you all know well, your district is working on the whole child tenets for very all-around integrated, healthy, safe, engaged, supported, and challenged students. At the same time, the Healthy Youth Alliance has all of these community organizations really focused on addressing early initiation, harassment, depression, and suicide. And at the same time, our public health improvement process is focused on addressing substance abuse, promoting mental health, and reducing obesity. And all of these efforts overlap. Before I stop, there's a lot more information at www.bouldercountyyrbs.org. And you're free to call me as well, and you can contact me through the website. And I'd like to turn it over for a minute to two people. I'm not sure who wants to go first. So Leisha Connors-Bauer will talk just a little bit about and exemplify what's going on in the community in terms of some of these shared initiatives. And Andrea Poniers talk about some of our public health improvement and Boulder County public health initiatives. Thanks. Let me go up there.
Good evening. I think I was volunteered to go first. So I just wanted to touch on really quickly some of the work that we've been doing with the Healthy Youth Alliance. As Namina mentioned, we surveyed the youth serving agencies after the 2009 data came out. And the reason that we did this is because kids live in our community. They don't just attend school and then stay home the whole entire day. You know, they're active, they're visible, and they live as part of this community. So what I wanted to know as part of the Healthy Youth Alliance is, so what are we doing with our community agencies in terms of supporting healthy youth? How do we address this YRBS data? Where are some of the points that we can make connections with the school districts with? So we did that survey, and I was somewhat surprised to see that so many areas within the YRBS data were being addressed by the different community agencies. And the interesting thing is, I don't think they really realized how much they were addressing it until we did the surveys, because even programs such as the YMCA of Boulder Valley that provides after-school care for elementary students or provides teen and middle school programming, that's primary prevention. That's the kind of thing that's helping kids stay connected to schools and stay connected to their communities, and it's doing that kind of work. And so that's the kind of work that we're trying to focus on within that community, is to do that primary prevention work so that we see changes in these risk behaviors over time. One of the things we use is that the survey results for is, and the YRBS trends, is to say to the youth serving agencies, you know, let's focus. Let's really focus our attention on some key areas within the YRBS data, and let's look at the numbers and determine what that is. And we did the usual dot voting kind of thing to see what are the areas that floated to the top that we thought, if we paid focused attention to, that we could make the most impact on, and one of which was those early initiation behaviors. And in this case, the community agencies also chose sexual intercourse before age 13 to look at addressing alcohol use, cigarette use, marijuana use, and sexual intercourse before age 13, coinciding with research that shows if you can postpone those behaviors until kids are older, then you lessen some of the future consequences. Harassment, as Namina mentioned, we haven't seen big changes in the harassment trends over time, but it has a deep impact on kids. So we're looking at creating strategies, and we have a subcommittee that's working on that, as well as depression and suicide, because that's one of the things that at least I hear consistently from parents is that it's really hard to talk about depression. It's really hard to talk about depression and suicide with kids, particularly because sometimes it's difficult to discern what's typical teenage behavior as opposed to something that really needs to be intervened, like if you see a student that's depressed. We have some folks who said that any time a teenager commits suicide, it's an incredible loss to our community because we've just lost so much potential. So for us, that's one of the areas that we're really trying hard to focus on and looking at where are some of the gaps? What might be some of the things that we're missing that we could implement in our community? Some of the ideas that we've floated have been looking at doing professional development trainings for staff who interact with kids on a regular basis that might not get that kind of expertise. Looking at how we make resources more available and just some ways in which we can make it easier to talk about those kind of topics. So that, in a nutshell, is some of the work that we're doing with the Healthy Youth Alliance. I had the opportunity just yesterday to meet with Dr. Messinger and some members of the cabinet in ways we can more closely integrate some of that work with the school district. So I think there's a good chance you'll be hearing more about that in the future. Thank you.
I'm Andrea Poniers. I'm the Community Health Division Manager at Boulder County Public Health. Excuse me. And I'm just going to give you a few examples of how we use the data from the YRBS in some of our programming. How many of you are familiar with the prevention intervention programs in the school? This is where mental health partners staff are in, I believe, all of our high schools in Boulder Valley and most of our middle schools. And what they provide is early intervention with the students, so one-on-one, and they also provide prevention activities. So, you know, school-wide assemblies or other presentations, media campaigns within the school, that sort of thing. The data from the YRBS are directly related to those activities. So each, boy, I'm barely able to breathe today for some reason. Each of the schools, each of the prevention interventionists in the schools is required to do a school plan relative to those activities. And that plan is conducted with the prevention interventionists, with the school principals and other staff in the schools. And those school plans for what will be presented in the schools is directly related to the data. The data must be used in that planning. Excuse me. Another way that those are used is with our LGBTQ kids, with the youth in our schools. We have a program at Boulder County Public Health called OASIS, and that's a program that, much like your safer, thoughtful, and more inclusive environments, we have the same mission relative to both the community as well as our schools, relative to our youth here in Boulder County. And so that program works directly with youth as well as working with agencies, as Alicia said, and with the broader community to try to make that more inclusive. When you look at the data that are presented there, I should say the disparities data relative to our LGBTQ youth on most risk factors and most protective factors, it kind of really compels you forward relative to working with that population. And so when we work with the youth, we look at those data. We have youth groups where we provide educational opportunities for those youth, and so we directly relate it back to the data. Similarly, we come to the schools at your invitation, and we do trainings with teachers, with counselors, with other personnel in the schools. We advise the gay-straight alliances when they ask for our help as well. Again, once we go directly back to the data, and we use those data to really provide the staff with the type of information they need in order to best help the youth in our schools. Looking at some of the data relative to smoking, cigarette use, and other there's a lot of devices now actually for smoking, but other tobacco products. One of the things that we're really looking at is the fact that youth smoking seems to be going in a positive direction, but use of other tobacco products maybe not so much. You saw something perhaps go by quickly about cigar use. We have a real issue with cigar use in our community. So when we try to understand the success or lack thereof in our work, we have to look at all of those factors. And the YRBS shows us where we're making progress and where we're not. And so that's a very important use of our data. And then to piggyback on something that Leisha was talking about relative to broader community efforts around alcohol, one of the other activities that is going on, and we just talked with Dr. Messenger about this a few weeks ago, is there's a coalition in town called the ACT Coalition, Addressing Alcohol Concerns Together. And this actually started with the City of Boulder and with CU, but has now broadened to a bigger group of partners. And the reason why these data become so important to that effort is that it is college students that are creating a role modeling in this community relative to what is acceptable behavior for drinking alcohol, for using marijuana, et cetera. And so using data such as you see there relative to especially the concerns around marijuana help us to inform what we need to be doing on a broader community level as the Boulder Valley students move up into CU as CU students, or what they're observing relative to CU students on these issues. So we can take these data back to that coalition and say, here's an area we really need to make some emphasis with marijuana, with alcohol, et cetera. So those are just some examples of the way in which we take these data, we bring them back into the community, back into our coalitions, back into our programs, either through the health department or other agencies, to really try to move the needle in the positive direction in some of these risk factors. So, thank you.
So a lot of information. Well, first of all, I want to just express our appreciation for Boulder County Health and the partnership that we enjoy, as well as St. Vrain, and collecting this data. It is very informative to us. And as Leisha said, we met yesterday talking about, how do we operationalize this as we work on school and district level planning. And obviously, we're all going to be involved in some of those conversations. Last March, I believe it was, we had talked some about the YRBS data, knowing it was 2 years old almost, and that we'd be receiving this report this evening and this data, which will feed into our planning process at the school and district level. So our appreciation to our partners with this, and I think our intent now is to provide you an opportunity to ask questions for clarification or just additional information. And we know there's a lot of information, and it will take time to wade through all that, but it is made available to you and will be posted on the website as well. So, Jim.
And thank you for a good presentation.
Thank you.
I think much more optimistic than presentations I've seen in the past. I think mainly the focus around what we can do and giving us opportunities to affect some of those outcomes. So with that, do we have questions? Tom?
Again, thanks for coming. It's a fantastic work you're doing here. Fantastic amount of information. I did look at all the tables, believe it or not.
Wow.
I scanned through them and tried to understand where they were going. And you told us a lot about the what and the who. And I'm curious, too, about what you found out on the why. In other words, the perception of marijuana usage, is that related all to medical marijuana and the attention it gets in the media and so on and so forth? Are some things like that? Have you been able to gather any information like that?
Well, that's not information that would be gathered by this youth risk behavior survey, but my colleagues have conducted other sort of types of information gathering and also working with youth directly, where I think they've gotten perspectives on, for example, Leisha has conducted the youth summits and has worked with kids directly, and Andrea supervises programs that work with kids directly. So I don't know if you want to address the question from what you've heard straight from the kids. There's scientific literature,
Right.
but I assume you want local
Yeah.
perceptions. Yeah.
We haven't done a youth summit in a number of years, mostly because we were seeing that the comments that we were getting from the students hadn't changed much, especially at the high school level. But one of the things that kids have told us that's been fairly consistent about marijuana use, and more so in Boulder Valley, is that they think it's less harmful than alcohol. They think that because it's a natural substance, that it's less harmful to them. And that some kids talk to us about seeing adults use marijuana and the acceptance among adults, and that has influenced their perception of marijuana use. Nationally, I think there's starting to be a little more research that's linking the two. Sheriff Pelley recently shared a statistic that he had access to that showed that in places where there has been medical marijuana use, that the perception of the risk or harm of marijuana has decreased among kids. But that was a national statistic, not something locally.
Yeah, thanks. That's great. I mean, it's good to see the trends and where things are going to help us address those areas, but I would think any information you could help us understand on the why would help us now target our programs a little bit more to a root cause, perhaps. So, thank you again.
I want just to contextualize that decrease in perceived risk of marijuana. I want to mention that the prevalence rate of ever using marijuana, current marijuana use, and having smoked marijuana before age 13 did not significantly change from 2009 to 2011. No more, no less.
Well, this is going to be my last report I get to hear as a board member, so I want to really thank everyone for this partnership and all the hard work. I know it's exciting to hear how, especially with declining resources, using this data to leverage resources and programs, and it's great to hear that we're working with CU too, and I think it's just fabulous work that you've all done. And I think about Penn also and all the work that Alicia's done through Penn. I know that in response to some of the data and information, getting speakers coming in and letting our parents become better informed and educated about these issues, it's really is getting the whole community together, and thank you very much for doing that. One question I had, I also had the one about the medical marijuana, but the issue with weapons, obviously our district is not as bad off as some where they actually have metal detectors and so forth, but I'm just wondering the way the questions are worded, can you tell whether it's like weapons are at school actually versus outside of school?
We do have, did anybody bring the actual survey? There are various questions on weapons, and I believe one is carried a weapon anywhere in the past 30 days probably, and then the other is carried a weapon on school property. So you can differentiate that. And you can go into your data tables and look at the differences there. So,
That's, obviously that sort of raises my hackles, like, oh dear, we have weapons coming into our schools.
yeah. We also ask whether they've been in a physical fight on school property, whether they've been injured or harmed in the fight, so much so that they had to get medical attention. So a couple different questions around that area.
Yeah. All very interesting.
Well, thank you. Thanks to the partnership. It's been great.
Yeah, thank you. I concur with everyone. This is a lot of hard work and very helpful information. Just to follow up on Leslie's question about weapons, do we know, does a kid consider a Swiss Army knife a weapon, or?
Well, actually, Alicia has a lot of experience in what the kids end up saying and asking when they read that question, because there is some interpretation involved. So, go ahead.
I think that's an interesting question, and it's funny, I was just thinking about that when Leslie asked her question, because the question doesn't define weapon for students. And so we've had some comments about this, about, what does district policy define a weapon as? And so if a student knows that, then that's the guideline sometimes they'll go by. But almost every time we do the survey, we get several classrooms where they will ask the survey administrators, well, I carry a pocket knife, is that considered a weapon? Well, and the tricky thing is the survey administrators cannot provide any guidance for the students on what a weapon is, because if we did that, we would be giving them guidance on how to respond to the questions. And so they need to be able to interpret that for themselves. And so usually we just ask them, well, what do you consider a weapon? And then they have to answer the question in that way. Because for some of the survey questions, there are things where it provides examples of what a weapon is, what they mean by that, but they don't for weapon. They just say broad things such as gun, knife, or club on school property. And so sometimes it's the knife piece that kids will ask questions about.
Mm-hmm. Well, that's helpful and may be of less concern than you might think. The other question I have is, I'm assuming these surveys are done anonymously, so there's no way for you to identify a kid who might say they're extremely depressed or something.
Correct. So they do not put name or identifying information on the survey. We actually go to great pains to make it, to make students feel very comfortable answering truthfully. And when we report the data, you might have noticed in the data tables that you've reviewed, if there is 3 asterisks there, that means that there wasn't a sufficient group of kids in that category to report. So fewer than 3 kids who reported that behavior out of a group of fewer than 30 kids. So even in the reporting, we're careful not to do any kind of singling out. We've also done things like had volunteers We have volunteers administer the survey rather than having teachers administer the survey. We provide, a white sheet of paper to cover your responses. You put your answer sheet in along with everybody else's in an envelope that gets sealed up and things like that, so,
Okay, thank you.
yeah.
I just wanted to say thank you to the Health Department for your work and the commitment to think about kids in our community. It's really important, and it's a really impressive survey that you've been working on for years, and so thank you for this work. I had a question. The school district has made a big effort to think about wellness and health and nutrition, in particular nutrition, and have changed our guidelines, some also in compliance with federal guidelines about nutrition and what we serve at our lunches and what's available on campus. And I'm always curious about the effectiveness of that program and ways to measure the effectiveness and the changes that are happening within our community in terms of diet and food and exercise. And I wonder if, one of the people on the Boulder County Movement for Children asked me one time about the possibility of keeping records or knowing about obesity and weight as it relates to the implementation of this program and how we've thought about keeping that kind of data. Do you have any data about that?
So on the YRBS, we ask kids for their height and their weight. And from that, we calculate the prevalence of overweight and obese kids. Now, that's their reported height and weight. So it might not be right on, but it's something. We, speaking on behalf of the community, especially the public health improvement process, be very interested in tracking exact heights and weights because reducing obesity is one of our 3 major focus areas. We've been able to get data from our Women, Infants, and Children's program on overweight and obesity. That is one specific socioeconomic and otherwise category. And we get information on adults through the behavioral risk factor surveillance system. And the child health survey, which is again based on parents' recall of kid information, can provide some information as well. But we're very interested in partnering to get more exact measurements and more often. So, do you all want to add anything on that effort from our camp? Sure.
I can provide one example of where that has been done in the state, and that was, I don't think it's been done for the last 2, maybe 3 years, but there's an oral health screening done of, I believe it's 3rd graders. The CDC sponsors it, and there is oral health screening done of 3rd graders, random sample, to check the status of oral health for our students. And there were 3 years, I believe, where in conjunction with that oral health screening, they also measured heights and weights on 3rd graders. And so they had a representative sample for the oral health check, and that also gave them a representative sample then for the heights and weights. But very, just a limited look, but it was 3rd graders, and so it's just an example of how that has been done, but not without its controversy relative to parents also, so.
I was just going to say that would not be without controversy with the parents. I think it's less important that you know that there's 5% or 8% or 12% kids who are obese. I think what's more important is that we educate kids about why that's the case. For example, high fructose corn syrup in the stuff that they're eating and drinking. And if you just did that in general, that would benefit the entire population, whether they were obese or not. And that seems a way better use of resources to me than identifying who's overweight and making that be more of a stigma.
I just echo everybody's thanks for your hard work on it and your commitment to public health and our young people. One question, when we say we're above average or below average, what is the statistically significant percentage there?
So we're actually not comparing to an average.
Okay.
We are comparing our prevalence rate to, for example, the state's prevalence rates. So there's no average or standard at play there. We could compare what's going on here to, for example, a Healthy People 2020 goal, or some other kind of benchmark or standard if we wanted to. There are relevant goals for some of these indicators, and there aren't for others. Yeah. And when we are saying that we are better or worse, statistically, that means that the confidence intervals, for example, at the state level, do not overlap with the confidence intervals at the local level. So, sort of a statistical formula for that.
So there's no fixed percentage there?
We do not compare to a
Okay.
fixed percentage.
Okay.
You all, for example, as a school board, could set a goal to get to, and we could compare where we're at. I think we have, for the Public Health Improvement Program, we have set some goals on mental health indicators, healthy eating, active living indicators, and substance abuse indicators, and we then go out and collect data and see how we're doing compared to those goals. Yeah.
And just on this harassment slide, it's really frustrating to me to see that when we want all our kids to feel comfortable and like they belong at school, that so many of our kids are feeling harassed for these various characteristics. I know we work on this in our classrooms in our schools. Why are we not moving the needle on that?
That's a good question. One way to look at it is that it hasn't gotten worse in terms of that line over the last 3 administrations. So I want to put a positive spin on it. It hasn't gotten worse. I know in some areas of the country it has gotten worse. I don't have the answer to that question, but it would be good to look at it. Some of the other questions on the YRBS might point to that. We ask kids if they felt sad or hopeless, so sad or hopeless that they've stopped doing their regular activities. In the recent past, we ask them if they have somebody to talk to when they're feeling sad or hopeless. We ask them if they usually get the help they need when they're feeling sad or hopeless. So to try to get at some of those sort of pre-indicators for feeling down and having support, things like that. For harassment, we also ask kids whether they feel safe at school or whether they felt so unsafe that they haven't gone to school, actually, is the way the question is phrased. Again, no big change over the last 3 administrations in that. So it'd be a good one to look into.
This is great, and I love to see these kind of school-community partnerships because we are part of an organic community, which sort of raises a question, maybe for Bruce, which is, I don't understand, I mean, we have a number of schools, 1 high school and 2 middle schools in Broomfield that are not part of Boulder County, and we may have some Gilpin County, I don't know. So I'm just wondering, does that affect the quality of these kinds of services and partnerships that are available? The fact that we have this chunk of Boulder Valley that's not even in Boulder County?
So there's both, I think, the collection of data and our consideration of that in our planning and goal setting, which of course we are one district. I think sometimes when we get into service delivery models, looking at City of Boulder, looking at county, Boulder County, and that. So, I mean, really we almost have to look at each of the areas to say, I mean, we have some of our budget discussions actually last spring related to unique services that were provided through district resources because some of those services weren't available because schools weren't in the City of Boulder, for example. So I think we would want to take a comprehensive look at that. I mean, clearly when we look at it as a district and as school-specific, we would, consider the needs of those specific sites. But yeah, I think the fact that we overlap multiple municipalities and also multiple counties, it does make the picture somewhat more complex, but certainly not insurmountable.
But we're gonna be doing some work
Yeah.
looking at that and making
So
sure,
look at that.
I would support that. And let me see. I share Sam's concern with the particularly the figure that 25% of kids reported they'd been harassed at school. That strikes me as really unacceptably high, and so I hope I think that's one of the areas we're going to be addressing goals, and it's one of the areas that I raised earlier that CASB is working on. So I think as we go forward, that'll be an area that we need to be continuing to address. I think I shared with you earlier that I talked to a neighbor recently who had pulled her children from Boulder Valley schools because of issues with bullying, which breaks my heart, because I'd like to see our schools be a safe place for everybody. Let me see. I had one question about one of your figures. I couldn't quite understand how it is that the number of kids taking PE in middle school has gone down. Don't we require that? And has that requirement changed in any way?
Deirdre, do you want to address that? Dr. Pilch?
We do require it, and I'm confused by it too as well, Jenny. So we'll look into it. But if you keep in mind that many of our middle schools are on trimesters, at the time of administration, they might not have been in a PE class. And so I believe that the survey asks if they're in a physical education course.
Currently, but that's how it's asked?
Yeah, currently.
In October, on a certain day in October in 2011.
Right.
So some percentage of our students
Right.
wouldn't be in physical
But
education.
that wouldn't have changed. I mean, we have a certain number of
Well,
kids taking health and.
It might, depending on how the courses are offered each trimester, so it could. But it's something we need to look at, and Jonathan and I can look at data another way to see if we're seeing a decline. But it's pretty standard across the middle schools that they're not waiving PE requirements. I just had a conversation today with a middle school principal about that.
Yeah, okay. I just was puzzled by that and wondered what people made of that.
Yeah, it's a great question.
Yeah. And another comment about the texting while driving. I mean, back in the day, many years ago, we used to offer, I mean, it seems to me like some places public schools offer driver's ed, and I think it's one of the regrettable things about budget cuts in Colorado, the inability to fund public education adequately in Colorado, is that we don't have driver's ed at least available. Because I don't believe we even offer it, do we offer it anywhere?
Community school.
School, you can?
We do offer it through community school programs. We have a lot of offerings.
Okay, well then I won't be quite as indignant, but still, it would be nice if that was more, I mean, it's just one of the things that we could offer to teenagers that would make driving a whole lot safer. And as somebody who was hit by as I was out walking last year by a teenager who was not paying sufficient attention, I think it was some other piece of electronic equipment in his car, but the idea was the same. I'd like to see us be a little more careful about that. I broke my glasses. So thank you very, I think that's, I'm just checking real careful to make sure I haven't forgotten anything. Oh, and then I had one more question for you, which you talked about the 3 focus areas that you have, and one of them, when you mentioned that
For the
during the
public health
conversation of
improvement
obesity. So I wondered what the other 2 were, and then how you determine what those focus areas are.
Sure. So the public health improvement process is a community-wide effort to look at, really assess the health status across the community with the participation of the community, then look at our capacity to meet those needs, and then look at what the evidence-based practices are that exist out there to address those needs, prioritize those, identify a couple of focus areas, and then come up with a plan to address them and carry out the plan. That, in one sentence, is a 5-year work plan. The 3 focus areas are, as I already mentioned, reducing obesity, or focusing on healthy eating and active living, substance abuse, addressing substance abuse, and addressing mental health concerns.
Okay.
So those were chosen based on a very lengthy and high community participation, high community engagement process, where we had focus groups, we had interviews, we had forums, things like that, where people came together and reviewed the sort of the scientific evidence out there, as well as agency capacity to deal with some of these problems.
Okay.
So
you
you
sort of
can
a
go
process
to
like our
for-
school district plans to go through in some ways to set goals
Right,
for ourselves.
exactly. You can go to www.healthybouldercounty.org for a description of the process, the FIP, Public Health Improvement Process, as well as more information on those 3 areas.
And then one more quick question. I remember a number of years ago, there was some conversations, maybe not with you, but locally in the state, about the traits of healthy kids. I mean, looking at what makes healthy kids healthy, so that you can hopefully replicate that in kids that are not always at risk. And I wonder if you've done some work with that. or
Well, it
you
was
continue
probably
to work
about,
with that.
I'm assuming, I wasn't here, but it might have been about the same time
maybe that
that
was
the
it. Thank you.
questions on preventive behavior were added to the YRBS. Yeah? So questions about, not only about things like exercise, but about how many meals do you eat per week with your family?
Yes.
Do you engage in community service? Things like that that are preventive. We added how much sleep, basically. Do you get more than 8 hours of sleep? Or how many hours of sleep do you sleep on an average school night? Things like that. So we're tracking those and like to feature those as well. You should let us know if we're ever too much focused on the risk and the
No, I think the risk
bad
factors
stuff.
are important. I just think I think sometimes when you're trying to address those at-risk kids, it's useful to know what makes a
Right.
healthy child.
Right,
So-
right.
I figured out what you're talking about.
Lori's always called assets, I think, but yeah.
I think that what you're referring to is there's not a process, but an effort within the state to, when they had assets for Colorado youth.
Yes.
And looked at the 40 developmental
was
assets.
it, yes,
Yeah,
yes.
and tried to replicate that statewide. And there was an effort in Boulder County to do that, and I know that Parent Engagement Network offerings are still built on the 40 developmental assets. And I think what's happening now is we're talking more of it in a more generic term in terms of positive youth development, because the Colorado Legacy Foundation, who's doing a lot of work on bullying and bullying prevention, is really based on a positive youth development model and partnering with Kaiser. So it's still there, it probably just has a different name.
Okay, oh, no, I'm glad to hear that. Makes sense to me. Thank you. Thank you.
Sure. I had one more question. A group of students that you mentioned was the gay and lesbian GLBTQ group of students. And I'm just curious if you have a sense about, actually, as long as we're talking about the positive aspects, what sorts of supports are in place in the community? I mean, you mentioned a couple of them that the health department has and that the Y may have. But are there other groups, or what's your sense about what we're doing with that particular group of students? It's a group that I think is pretty at risk.
Definitely at risk based upon the data. Also, let me say, to a small extent, definitely very much showing positive youth development in Boulder County. I think we're very fortunate here. I already mentioned the OASIS program through Boulder County Public Health, in which we have, I forgot how many, I can't tell you off the top of my head how many youth we serve in youth groups and other activities. Boulder Pride is a City of Boulder organization, but serves the county, not City of Boulder, but located in the City of Boulder. Also has youth groups and positive youth development. In both school districts, we have Safe Schools coalitions that are very much focused on trying to create, as you were asking here, why is this? What do we really need to do? And it really is creating that school climate across the board that is welcoming, open, and supportive for these kids, from the teacher to the janitor to the lunchroom to the other students, just creating that entire wealth. So we do have Safe Schools coalitions in both school districts, as well as some other, I would call it more ad hoc, less organized activity. But I would say that Boulder County is very wealthy in terms of its attention here. And our potential for actually moving the needle for that the group of students. So we do have a lot going on in town.
Okay, I won't keep you too long. I thank you, as well as everyone else. I'm kind of reminded of a systems view of all of this, and that sometimes as a school board we think academics first, as we should, but I think as a school board we've also done a good job of thinking outside of just academics and saying, a hungry kid isn't going to be able to learn as well. And so how do we address that? And we've put in some morning breakfast programs where it was indicated. So the part that 10% are still going hungry seems like we can change that number pretty directly if we put our mind to it. And I would hope that we would. I think in particular, I echo several other board members. I'm concerned about the bullying, the harassment. It's an issue that is constantly coming up in in my circle of friends at work, et cetera. And, some of it gets masked by students leaving the schools to another school, only to start the process again. And I know that the interesting thing in that data, and I don't know if you asked the question, was, have you been bullied? That's one answer. But the other question is, are you a bully? And I bet that answer is 0%. And while we have gone to great lengths to teach students and adults in the schools what to do when they see bullying, there are people who are doing the bullying that just don't even understand that that's what they're doing. And, I hope as a society we're going to be able to figure out ways to reach out to those people. I do know that in some instances, or in most of the data that I've seen, that the parents who are bullies have children that are bullies. And so getting through to parents is a particularly difficult thing. I've had conversations with other parents whose children needed to have a conversation, and you end friendships that way by doing that. And so, as a district, whatever we can do with harassment, whatever we can do about bullying, I'd welcome anything that the district brought to me, and be pursuing it any way I could. So anyway, thank you for the presentation tonight, and thank you for staying here and going through our questions, and also the invitation that should we have further follow-up questions, we know how to get a hold of you.
Yeah, please do get a hold of us, and thank you on behalf of Healthy Youth Alliance and Boulder County Public Health, as well as St. Vrain Valley School District. This is a partnership, so thank you. And I just want to take off my public health hat for a second and speak as a mom of 4 kids in the Boulder Valley School District, and just to counter your the testimonial that you had from your neighbor pulling kids from the district. My kids are surviving and thriving, and I really appreciate it. So I see the rubber hit the road with these statistics in my kids, and really appreciate all the effort that goes into collecting the data and then acting on it. So thanks.
Thank you. So next item for the board is action items consent grouping, which tonight includes personnel, the approval of minutes, June 26th regular meeting, board policy GBEA, GBEA-R, staff ethics, conflicts of interest, school and district accountability committee membership, chief academic officer, consolidated federal programs, titles 1 through 3, Colorado Department of Education 2012. I need a motion. Leslie, seconded by Jenny. Does anybody want to pull any items from the consent grouping? Any questions or comments about any items on the consent grouping? No? Seeing none, Sandy, would call the vote? Oh, I'm sorry. Okay, Shelley?
Accountability, term limits, right? That's what we're talking about. I'd just like to say that I am a big proponent of term limits. I think that it makes organizations more effective, more ideological, and it brings a lot more energy to any committee or group where people have a defined amount of time to make their contributions. And I really think 6 years is probably enough on DAC. And I would prefer, as opposed to getting rid of term limits, I would prefer that once people have served their 6 years, which is a wonderful thing to do, if no one else steps up, which I understand is the issue most of the time, that they could petition the board and ask for 2 more years or something in that event. But it's just my recommendation is that we should keep term limits and not get rid of them simply because there's a view out there that people aren't stepping up to do that job. That could mean that we're not making the job interesting or valuable enough that people want to do that, which is on us, not on them. So that's my thoughts about that.
So any other comments or questions on the consent? Oh, Sandy, could you call the vote?
Albright?
Yep.
Belleville?
Yes.
Benford?
Yes.
Fuqua?
Yes.
Myers?
Yes.
Reed?
Yes.
Smith?
Yes.
Motion passes.
Thank you, Sandy. Last item is, adjournment, but any items for the agenda? Any future items anyone would like to request? Seeing, Shelley? And then Jenny?
Just don't forget to
Oh.
react on this before Lori needs to take it.
Shelley?
Are we going to have a review of the goal development process somewhere along the line? Because I was surprised to see that there's already a straw man goal out there, and that people are already looking at that. So that's one question I have. The other is, I saw, let's see, Jenny's email today about, what was it about, I'm blanking now?
Oh, the teacher insight probably.
Yeah, are we gonna, or could we request a review of just how that's being used? Because we've had a significant number of emails on that subject.
Do you, go ahead on the teacher insight, Bruce?
So at this point, working with the Agenda Planning Committee last week on Shelley's last question about the teacher, well, probably broader personnel selection process, we've sort of targeted the second meeting of October for that discussion. We will have a briefing and an overview of the hiring season completed by then, and so we can bring that data to you and also discuss the process we're using. And I think we'll have a set of recommendations of changes that we either have already incorporated or we plan to, and so, but in later part of October, Shelley, it's tentatively scheduled for. And I could comment just briefly on the goal and the strategic planning if you would like, Jim. Or
Actually, I was going to go ahead
Go
on
ahead.
the goal development process. So I think one of the things was to get it to a point where it was draft form and enough to take to the community through the community engagement process to say, to ask the community, what's here that shouldn't be and what's not here that should be. It was really to give them enough that they can provide comment back to the board so that then we might make adjustments after that. You know, I understand that there may be board members who don't think that the goals represent what they are. I don't know what to do short of bringing the draft goals to the board and having us vote it up or down as a draft. If you have a different suggestion, entertain it.
Well, I guess I always kind of thought that we were gonna meet about the goals before we put anything out there. Not necessarily voting those goals up and down, but creating our own sort of straw man to take out to the community, so they weren't starting from scratch, because I think that's a good idea to give them something to look at. I just prefer that it was something that we came up with.
Well, and so I guess that's the thing is, if the board is unhappy with where the goals are at, that's one thing. And that's something that as a board, are we unhappy? And that's the thing. Short of voting it on a draft, we've had multiple presentations on it. We've had multiple work sessions on it that led to the presentations. We've asked the superintendent to kind of take lead to filter down all of those conversations into what we have as the draft goals. Not that we completely agree with all of them, but that was the direction we were going to get, so that once we went to the community with this, we would give them the opportunity. You know, if we put up a blank slate, we might not get the same level of input that we would like. And so, you know, I guess it's a question for the rest of the board. Is this something that we should bring back on another agenda, the draft goals? And we can. Bruce, yes.
while you ponder that, if I could add just, because I had forwarded to you in the last week, I believe, two different individuals whom I've made contact with that might be appropriate to facilitate us in strategic planning. This is a conversation we'd had in the spring and really had not had much luck identifying someone. And so those conversations will take place with some members of the senior staff and those individuals. And part of the preliminary conversations I've had with them is that there are probably some aspects around strategic planning that we may want to discuss that would relate to goal development and thorough analysis of needs as we go forward. So I guess, again, to think about with calendaring is that if it works, that we have earmarked on your calendars, you agreed, on September 13th, I believe the date, for a retreat day. And so in our agenda planning last week, I at least said on the table for consideration that if this comes together with identifying a facilitator that could work with us, I think there would be value of maybe stepping back, looking at where we are, looking at visiting with the facilitator about a process, and then say, relative to that, are we in the right place? Do we want to make some adjustments? Do we need to go back and refine or revise the goals? One of the things that I've been in conversation with them about is, what's our confidence level on the thorough analysis of our needs? And so I described what we'd gone through. And if there's additional work that we'd want to do on that might influence or shape the goal development going forward. So I do think there's some value at this point of incorporating, assuming we have somebody that works with us on this, looking at the process we're going to go through kind of from beginning to end, or build on from where we are, and then put these draft goals in that context, and which we really have not talked about the process of strategic development. We've talked about some needs and some goal areas, but we really have not talked through, because some of my sense is that we might have different definitions of what a strategic planning process looks like, which is to be expected with 7 or 8 people. So I think one of the advantages of working with somebody is that we can come together as a group and agree on what the process looks like, then reflect on where we are exactly and how do we go forward, and then where does the community engagement piece absolutely fit into that, and what questions are we going to ask, and is that phase 1 of a 2-phase piece. So I think that if we can get this, an individual locked in to work with us, I think there will be some in that September timeframe. I think we'll have a better sense of what the rest of this fall and year would look like. So that would give some additional context. So I just wanted to add that. Because some of you have asked about, about these 2 individuals and what are we looking at. And so we're really trying to find somebody who has some experience in facilitating organizations through strategic planning, and then decide whether that's a good fit for what our needs are.
Tom?
So since you asked the question, and I'm not happy where we are with the draft goals. I think we can do better than that. And I'm looking for, more of a in-depth discussion of what we're trying to address, how those go together. We've had, data on where we are as a district. I'd like to tie that a little bit better together and make sure that we are all on board as a board as to agreeing, what are the most highest priority areas. So, I don't, these have come a couple of times to the board. We've discussed them. I've voiced that I don't think they're the best goals yet. And so I don't know where to go with that, unless we actually get together and use this session, which I think is an excellent, idea that we talked about, to help us to get there, on one voice as a board. So that's just my input.
Thanks. Sam?
And I think that session will be useful, but I'm comfortable hearing from the community before I get too much further along. So I'm comfortable with taking a version of the draft goals out as part of our community engagement process after we've had our retreat on the 13th.
Excellent. Well, again, I think we did some work around consensus as a board, and we typically try and run as a consensus, but in essence, as a public political body, we are run by the majority, and so, it doesn't strike me that I'd like to incorporate voices where we can, and to the extent that somebody feels like their voice hasn't been incorporated, I'd like to understand that and try to address that. But on the other hand, we can talk about the goals, and we can talk about the goals, and we can then not have goals for 5 years. So I want to get goals in place. I don't want to get the wrong goals. I'm more of where Sam is at, which is I want to get this out to the community, because the community's input on this is extremely valuable to me, and we've kind of put it all in the hopper so that we could be out with community engagement in October. And to the extent we do something to delay that, that means we'll be delaying the adoption of goals. So I think a topic to continue to discuss at the next meeting, and maybe we should just put it on the agenda so that we can talk about it some more. So with that, maybe a motion to adjourn? Jenny. So we stand adjourned. Thanks.